Now, I take this opportunity to invite Melissa Nyakwera, the head agribusiness from Stanbic Bank. I wish you use 7 minutes. Yes, and meanwhile, John Nwagaba from Ankole Coffee Production Cooperative Union, be standby. You're going to make a presentation online. And also Sarah Murungi, Chief of Party Healthy Partners. I beg that you're also online. So you're welcome. In 7 minutes, please make a presentation. Come and use this.
All protocols observed. Good morning, viewers and fellow presenters. Thank you to Uganda Cooperative Alliance for inviting us to partner with you on this very special occasion for the cooperatives. My name, as introduced earlier, is Melissa Nyakwera. I head agribusiness in Stanbic Bank, and probably to just explain as to why I would be here speaking about on a day for cooperatives. And it's essentially because we do acknowledge the fact that you will note that probably 70–60% of the cooperatives in Uganda are in the agriculture space. So that's how the connection comes through. I will really not look at or dwell at the introduction. We've had all the history of how we've gotten to here from 1920 when we were looking at trade, and how we've evolved into, for the cooperative space, into other sectors such as agriculture, transport, health. And I'll just speak to my topic, which is really around strategies for cooperative survival and sustainability amidst COVID-19. So before I really get into that, or answering that, or responding to that, I want us to sit and think through what this pandemic has done for these groups of people. And there are 4 main things that have been affected. One is their ability to operate normally. Their ways of operating is you meet on a certain day of the week together to collect in terms of those that have savings, invest, decide on how you invest that, and then lend to those that need the financing. Now, in the current restrictions, that is really not happening. That's the first challenge that they are facing. The second one is the majority of these people are in the informal sector, and as such are not actually trading. So what has happened is they have essentially, for lack of a better way of putting it, I'll put it in the Ugandan way, eaten their capital. So they, even when we get out of this space, how will they start their businesses running again? So that's the second challenge. The third one is they have always operated in a way of manual processes. You know, they run, they use paper, at the very most Excel, to really run their businesses. And then the third challenge is, I think this one Honorable Francis Mwebesa did talk about, is around their management or governance levels, the lack of the capacity to run these entities sustainably, in a sustainable manner. To be, if they were able to do this, then they would be more resilient to such shocks as COVID-19 has presented. So, as a bank, this we started last year. We have therefore, as a bank, come up together with several funding partners with a circle proposition to address the above challenges. Our funding partners include ABI Trust, IFAD, that is the International Fund for Agricultural Development, UNACTAD, United Nations Conference on Trade and Development. So this fund, as we speak, our aim is to get to $100 million, still on our way into there. But it's essentially to address several issues. And I'll ask the team to put up the presentation to just show what it is we will be addressing with the fund. So that's really it. So one, we have what we call the circle account. The SACCO account is as a way of rebuilding these entities, the cooperatives, that are really looking to save, invest, and give credit to their members. We have what we call, we have a SACCO account where they will have, they are able to transact without any charges. They are able to deposit cash for free, withdraw cash for free. There are no management fees. If you have a income or extra funding, we can give you an interest on your cash of over 10 million shillings. This is tiered depending on how much you have. So that's one product we have to address the challenges. The second one is around financing. Financing as a challenge for the members, because they have more or less taken out the capital, and we need these entities to restart. So the financing aspect is going to be at 12.5% per annum in terms of interest. If 12.5 per annum means that the SACCO borrows at essentially slightly over 1% per month, and they can use these funds to then lend to their members. They can also use them to invest, to buy, if it's an agriculture SACCO, you're looking at probably putting up a dryer, a sorting machine, or a tractor, you name it. So that is how low it gets. It's up to 200 million shillings unsecured for 12 months. And we renew at the end of the 12 months, depending on your performance. We can go up to 36 months. And for that, we will need security. And the amount above 200 million is up to 1.5 billion shillings. So that's on the financing aspect. Then next to that is we have the financial literacy, which is really around capacity building of the management of these SACCOs. We have partnered together with Uganda Cooperative Alliance. That's, I think, how we got into these discussions with them to really understand what the needs are in this space. So these SACCOs that come or participate with us do have access to financial, to literacy, to capacity building for their management members, but also financial literacy for the members of the SACCOs. This will be done through our Stanbic Business Incubator, which has several hubs around the country. In addition to that, we have the digitization of the SACCOs and village savings groups. We understand, I did talk about the fact that they run their business manually. So we have partnered together with different fintechs to be able to digitize these SACCOs. They are more or less financial institutions. So what we are trying to do is to give them platforms, banking platforms, you would say, for themselves. So that's what the digitization aspect is. Then to ease their financial transactions, we encourage that the SACCOs register as bank agents, which would allow them to be able to receive funds from the members as well as disperse the funds. Also for the members, we've got what we call the Flexi Wallet. It's an electronic wallet that allows them to also move funds electronically without having to meet. This one is really to address the challenge around the physical weekly meetings. So this wallet will allow them to carry out disbursements, to receive loans onto their wallets, to also make, repayments on their loans. And for the SACCOs, it allows them to have, if you've digitized and then your members are on these wallets, it allows you to have dashboards for reconciliation purposes without having to go do it the manual way. So this really is what we have available, and our plan, our hope and belief is that it does address the challenges that the SACCOs are facing. We've also included the village savings groups, and we are here and ready to work with many more. We already have some, but we are ready and open to work with the several that are also out there. I've had interesting numbers. We've talked about over 20,000 SACCOs in this country. So it's just to say that we are available to work with them. and give them these very good opportunities so they can thrive in this current environment. We also would like to continue to partner with community leaders, government and stakeholders such as Uganda Cooperative Alliance as we look at bringing this economy back to its former glory. Thank you so much. Stay well and keep safe.
Now the next speaker is Sarah Murungi, who is the chief of party, that is the Healthy Partners. Are you online, Sarah? Please, Sarah, if you're online, proceed with your presentation. Hello?
Okay, I shared my presentation, so I'm hoping that the team on that side has it.
Yeah, the technical team will do that ably. Proceed with your presentation.
Okay, thank you very much. All protocol observed. My name is Sarah Murungi. I'm Chief of Party for USAID-funded Connect Girl Center activity. And we are working in all corners or all the parts of the country. And today we are privileged to be invited to speak at this celebration of the International Day of Cooperatives and to share something probably different from what others have been talking about, and that is about health cooperatives. I don't know if the host can allow me to share my screen.
Yes, please do.
No complaint. Time given to me was too little to make meaningful presentation.
Yes, can we have Sarah's presentation? Are you still there, Sarah?
Yes, I'm here.
Yes, please proceed with your presentation.
Okay. I don't know what is it.
You're being heard. You're being heard. Proceed, Sarah. Yes, Sarah.
Okay, so can you hear me?
We are hearing you perfectly well.
Okay. Okay. So in Uganda, we have two types of health cooperatives. The first one is where medical workers and allied health professionals came together to form a health cooperative, and they pool resources and probably establish a health facility. But the other one is the community health initiative, which is cooperative health insurance, that promotes the health cooperative model and in partnership with health facilities, with circles, with employers, with schools and member groups. And this is the one that I'm going to focus on in my presentation. As you can see in the map, this is where we are. We are in almost all parts of the country. We have trained healthcare providers in all these regions where you're seeing the blues and reds. And some are already offering not yet and being prepared to start offering care. This is how the model works. It's, as we said, it's a partnership. So we have members, and these members join in existing groups. So it could be an existing circle, it could be a school, it could be an employer group like a tea factory. And those identify a provider of choice because they need to access quality care, and which is also affordable. And each provider will have a data entrant who will focus on ensuring that services are only provided to members who have paid their premiums. And then these will form the health cooperative, and then they will elect a board. So the membership fees, the shares are paid into this account, and also the provider at the end of the year, if they make any surplus, they contribute 10% to that reserve fund. So we find this model, it's locally owned because the leaders are local and the members are local, and it's sustainable because we do not pay for insurance or reinsurance for these members, but also because I've heard the previous speakers talking about reaching the informal sector. We have found this a solution for reaching the informal sector with quality care, especially where government facilities may not be providing quality services. This is our newest health cooperative that registered in the Elgon area in December, and here they are displaying their certificate. We didn't have a health cooperative in that region. Most of them are in southwestern Uganda. So that is our recent one that registered with support from Ministry of Trade. What are the benefits of cooperative health insurance? There are benefits for care providers because this is a provider-based model, and members pay their premiums directly to the provider. So that prepayment helps the facility to plan and then also to maintain drug stock because they have money in advance to be able to pay for this instead of getting them on credit. They are able to motivate their health workers, but also this model improves the relationship between the community and the health facilities because they have meetings where they discuss their issues. If the health facility is not providing quality services, they have meetings to discuss. But also health facilities provide outreaches for members to learn and also to focus on prevention. So the shared risk for the members ensure that the healthcare provider is able to make a surplus after treating the patients. This is one of the testimonies from one of our the health facilities that is on the scheme, especially during COVID. They said they received 72 positive cases and 3 of these were cooperative members. And because of the continued education, they were able to just treat them and send them home because they had sought care early. And these patients encouraged their contacts to quickly come for testing, which helped the other families and the contacts instead of being critically ill. This is Kakoma in Isinjiro district. The benefits for the members, the premium costs less than out-of-pocket expenditure. The current premiums range between 20,000 to 50,000 per year per person, and that helps them to access care, basic care, including antenatal deliveries, but also when they seek early treatment, it means that they will not, the students will miss less school, and also the people that are working will miss less work because they are not severely ill. And then people do not have to sell their assets or even borrow to seek care because they've already paid their premiums in advance. This is one of the testimonies from one of the members that benefited from cooperative health insurance. She says before her husband joined, they used to spend a lot of money on medical care, but after they joined, she was able to get an operation and get treatment as part of the 20,000 premium that they had paid. And she was able to save the rest of the money to improve her diet. So there are many such stories in the community out there, and we can share them if people need them.
Sarah, are you getting me? Yeah, you can.
Now I can hear you.
Yeah, conclude in the next 30 seconds. Time is not our best ally.
Yes, I will, because I'm finishing.
Okay.
Health cooperative in the COVID crisis. There's a lot that health cooperatives did in the COVID crisis. This is Chitanga Health Center 3 in Ruchiga County. It was offering PPEs to other facilities. This was on offer because they were able to secure them early. They were able to offer to other private health facilities. But here down, you can see that they also shared with a DHO of public in government, and yet would have expected the other way. So basically, as we talk about building together better, this is the relationship. And then we had our Connect Girl Centers produce masks that they sold to the community at a very reduced price, but also that increased income for the cooperative youth centers to survive through the pandemic. Our networks, the cooperative health insurance network includes these partners. We have an MOU signed with Ministry of Trade, Industry and Cooperatives, and they support training, regulation, and policy guidance. We also have an MOU with Ministry of Health for quality control, since the cooperatives are offering health services. And then also we work with Uganda Catholic Medical Bureau, Uganda Protestant Medical Bureau, Uganda Healthcare Federation, USAID Health System Strengthening Activity, and we have so far signed MOUs with 22 district local governments to support communities to access this care.
I'm so Sarah, I have to cut you short. Thank you very much for that.
This is my last slide. Thank you.
Yeah, thank you very much for really joining us online. And yes, we are getting to the last session of today's actually dialogue.